Of the broad array of topics that we study in the plastic surgery research group here at Mount Sinai, my team has a particular emphasis on breast reconstruction. Over the past month, we've had 3 important papers published, and we love to share the findings of these papers with you. The first is entitled The Impact of Depression and Anxiety Comorbidities on Acute Postoperative Pain After Deep Flap Breast Reconstruction, published in the journal Microsurgery. Carol Wang was the lead author on the paper, and the entire team contributed excellently. In it, we looked at whether patients who had a prior psychiatric diagnosis had any different experience with pain in the early period after deep flap breast reconstruction. We found that they did. These patients had statistically significantly higher self-reported pain scores, overall pain medication requirements in the first 24 hours after surgery. We believe that the key implications from these findings are that patients with depression or anxiety who undergo deep flap breast reconstruction should receive even greater attention to their pain needs during and after surgery. And by having an awareness of the benefit that they would particularly receive, we should be able to get them through the early recovery period very comfortably. The second paper is entitled Neighborhood Deprivation is Associated with Increased Postoperative Complications After Implant-Based Breast Reconstruction, and it was published in Clinical Breast Cancer. Carol Wang again was the lead author, and in it we looked at whether socioeconomic factors, as indicated by something called the Area Deprivation Index, was correlated with the likelihood of having a complication after implant-based breast reconstruction. We found that this was in fact true, and patients who lived in an area with a higher area deprivation index had both a higher overall complication rate and a higher rate of reoperations compared to those who live in a neighborhood that have a low area deprivation index. We believe that this social determinant of health finding indicates that patients who live in areas with lower income and fewer resources warrant additional attention and services in order to ensure that their likelihood of complication is as low as it could be. Finally, the third paper was entitled Understanding the Role of Intraoperative Hypothermia in Perioperative Opioid Requirements in Immediate Implant-Based Breast Reconstruction, published in JPRAS, which is the Journal of Plastic Reconstructive and Aesthetic Surgery. As you can see, Carol's been very busy this year and was the first author in this paper as well. But Rihanna, Jamie, Megan, Esther, Peter, Alakshi, and Nargiz all did an excellent job contributing to the paper. In it, we asked the somewhat counterintuitive question whether allowing the body temperature to drop slightly lower than normal during surgery had actually a positive impact on pain after implant-based breast reconstruction. In the paper, we found that, surprisingly, it did. Patients who had a body temperature under 35.5 degrees Celsius had statistically significantly lower intraoperative, postoperative, and total pain medication requirements. Based on these findings, we're in discussions with our anesthesiologists about whether allowing the body temperature to drop slightly lower during implant-based breast reconstruction might be beneficial on postoperative pain. But there are potential implications on things like wound healing, and this will continue to be studied. Here on this team, we feel strongly about not only providing clinical work to women who are seeking breast reconstruction, but also advancing the science that teaches us and everyone else out there providing the same clinical care how to do it in a way that is as safe and successful as possible. Thanks to everyone on our amazing research team for their ongoing hard work, and we'll be back to share more updates next month.